I used to ring up the ambulance, the GP or the ambulance about once or twice a day.
%80 of our health and well-being is determined by our social, our economic and our environmental conditions. In Bedfordshire, people who are in deprived areas have 10 fewer good years than people who live elsewhere, and 12% of our population are from these deprived areas. Population health management is a way to proactively look after our patients, so we're able to predict their current and, most importantly, their future needs using data intelligently. Health inequalities are things that we deal with every day in practice, and the COVID pandemic just highlighted that gap and it made it even worse.
Jane has a number of long-term conditions, including diabetes. She has heart failure. She also has some learning difficulties. Over the COVID period, she became very sedentary. She didn't have very many social interactions and she was quite lonely.
My health wasn't very good because I was not taking my medication and I was eating all bad things.
We came together as a team. We had GPs, pharmacists, social prescribers, data analysts as well, and we're able to identify the small group of people with heart failure and who were also socially vulnerable. You might think that 37 people is not a lot, but actually these were the people who were in the highest risk group, and they were the people who were more likely to use healthcare because they didn't have other options. They didn't know who else to call. Jane is a typical person in this cohort, and it's interesting because what we think Jane needs usually isn't. So, for instance, Jane needed help with things like getting a TV, sorting out a sofa, very simple measures to enhance her quality of life.
We talked quite a lot about what was important to her, identified her various conditions and the problems that she was having. We worked out a care plan. We worked quite closely with the council to prioritise the repairs to Jane's ceiling. So it's really improved her mood. She quite looks forward to getting up in the morning.
I'm a lot happier now because I've got my ceiling all done and my nice walls painted with the colour I chose. I feel a lot better.
Titan Primary Care Network recognised the importance of social prescribers. So the social prescribers, the pharmacists, the community nurse as well, the GPs, wrapping around that support for them just made things much easier. And the patients in this group were very happy and the feedback was amazing.
Working as part of the ICS has allowed us to be proactive with finding vulnerable groups in need of support. It's allowed us to work in partnership with many other groups, secondary services as well as the voluntary sector.
Most of what we do as GPs is firefighting, where patients come and they ask for help. So this approach helps bring together not just the health aspect of the patient in front of you, but the social aspect as well. It's important to all GPs. It's something that we have to continue to do. Our patients are happier, they are healthier because we are taking into consideration things like housing, how they're living, debt. It feels fantastic to know that we're helping people.
Some of the people that I support don't have anybody else. Knowing that I can make a difference just makes every day worthwhile.
I'm a lot happier since I met Vicky.